so much, Taylor, for the invitation. Excuse my toddler in the background, who is having a little tantrum. So for this presentation, I'm actually going to go over about 4 years of work with Google Street View, carrying through some iterations that we did with this data source. So Google Street View is a component of Google Maps, and it was relatively newly launched compared to other data sources in 2007. It's characterized by high resolution images and eye level views of things that, as a social terms of health researcher, I'm interested in. So the built environment, the neighborhood environment. So you see homes, businesses, schools, streets. So it's collected via special cameras that are mounted on cars that drive down the road. And because that's the data collection, it's only available for places that have roads that the cars can access. And also another thing to keep in mind is that Google updates its images at varying levels depending upon like the population density and weather conditions. So in our research, we find that rural areas, for instance, have lower frequency of image updates, so the images are older. But that's something to kind of think about and kind of as we go along with these studies, so to keep that in mind. Okay, so I'm just going to quickly go over the first study that we did. And this was a pilot for the R1 grant that got funded. So this was the what helped us get NIH interested in this work. So we looked at collecting Google Street View images from 3 visually and geographically distinct cities. Salt Lake City, Utah. Before I was in Salt Lake City, Utah, and then Chicago, a big city, and then Charleston, West Virginia, which is kind of medium size, slightly ruralish location. So these are from different, locations across the U.S., and they have very different visual landscapes and looks to them. So for each city, we collected images from street intersections. So for Chicago, it had the most street intersections. So there were over 200,000 images for Chicago. For Salt Lake, it's 150,000, and for Charleston, it's 53,000. And we collected 4 images per location, just to try to get at a 360-degree view of each location. And we extracted the following 3 neighborhood characteristics: crosswalks. So yes or no. Sometimes people ask, why didn't we choose sidewalks? We initially looked at sidewalks, but just with our to kind of select the features, we manually labeled them, and we found that sidewalks in these locations were really very, very high in its prevalence. So it was having hard trouble distinguishing between areas. So crosswalks was much lower in prevalence and could distinguish areas better. So we ended up picking crosswalks. And then we looked at building type. So when we were looking at images, there were certain neighborhoods that were characterized by all single family homes. And then there were other neighborhoods that had single family homes, but they all also had like apartments or schools or businesses. So that was like one characteristic that seemed quite distinct and kind of stood out to us when we were looking at these Google Street View images. And then third, we chose street landscaping or greenness. So these include street trees and street landscaping like bushes and grass. And we picked the 30% mark just because when we're looking through the images manually, most images will have some type of greenery, but there is a certain point where it was like ample landscaping versus kind of sparse. So we picked the 30% kind of range in that it seemed to separate well the neighborhoods that had a lot of street trees, a lot of landscaping versus those that only had minimal landscaping. So as some of you know, when you're doing supervised like machine learning, you have to provide the models with training data. This is so that it can learn how a human would label the data. And so we labeled in total about 15,000 images manually by 4 labelers. And initially we started out with about 13,000 plus images from Chicago. And then we just wanted to see whether performed well for all three cities, but we soon realized that the performance was less for Charleston, which is more rural than both Chicago and Salt Lake, and so it was having a more difficult time with lower accuracy for Charleston. So we labeled an additional 2,000 images specifically from Charleston to try to increase its recognition of how these features would look like in rural areas. So I think that's something to keep in mind. The labeling effort, sometimes you will need to infuse it with data in an iterative fashion to kind of achieve the level of accuracy that you want, and to kind of show the model the extent of the heterogeneity that you expect in your analytic data set. So the accuracies are quite good. So we use deep convolutional neural networks. So this is very common for object recognition. And the accuracy is just defined as the agreement between the computer vision label and the manual label by humans. So it varied between 85% and 93%. And so we found that to be pretty satisfactory, especially because we didn't have to label 500,000 images. The model could go on and do that for us. So these are just some example pictures. This is an image where green 30 is indicated as 1 because it's quite ample landscaping. Crosswalks is 1, not single family home is 1. So not single family home, that means there is a building other than a single detached family home. So you see there are larger buildings here. And one thing to note, crosswalks, like this crosswalk is right out in front, but we find that it's able to label correctly even if the crosswalk was at the other side of the image. And it's also able to label winter scenes because in our labeling process, we did label winter scenes as like, if there were a lot of trees that were bare, we still label green 30 as 1. And then the model recognized and was able to accurately predict green 30 from our manual labels. Here's another one, green 30 is 0 because there's less than ample green space. There are no crosswalks and there is a building other than a single family home. So these are just some more images to show you some more examples. So across the 3 cities, we had characteristics that differ. So Charleston was the most green, as you can expect, it being the most rural. Chicago had the most crosswalks, and commercial buildings were also most prevalent in Chicago as well. So this is just a map displaying the distribution of the characteristics across our 3 locations. This is Salt Lake. And these maps are kind of just useful to understand and see, spatial distribution. This is Chicago. And then you can kind of see the neighborhoods look different. And this is Charleston. Okay, so we did analyses where we looked at demographic and economic predictors. So higher median income was associated with more green streets and fewer commercial buildings, or fewer not single family homes. So generally like the suburbs, for instance. Okay, and then we looked at individual level health outcomes. So we pulled in health outcomes from a unique data set called the Utah Population Database, which is a database that has both clinical records and administrative records from individuals living in Utah. And so these individuals were living in Salt Lake City, and we looked for 2 outcomes: adult obesity and diabetes, type 2 diabetes. The model is controlled for individual level age, sex, race, ethnicity, education, marital status, as well as some zip code level characteristics like percent of the population 65 years and older, percent Hispanic, Black, median household income, percent living in the residence for 5 or more years. So we're in controlling for these variables. We're trying to isolate the associations between the Google Street View derived built environment characteristics and health outcomes. So as you can kind of see, for green streets, crosswalks, and not single family home, i.e. commercial buildings, apartments, were associated with lower obesity. So it varied between like 27% and then 21. So it was pretty substantial. And it was also associated similarly with diabetes in terms of its these characteristics associated with reduction in chronic conditions for both obesity and diabetes. So we saw that the model was able to predict these built environment characteristics across very visually distinct areas in the US. And it seems like these characteristics were also predictive of health outcomes. So that was the work that started us. But we would, like the limitations include, there are many. So I would say image data is only able to capture a subset of features. We try to look at other items of neighborhood characteristics like litter, but even in the manual labeling of images, it was difficult to distinguish litter from leaves. So I would say computer vision would struggle with very small features. So in a way, if you're using image data, you'll be limited in the type of neighborhood features you can examine. And also the analyses that we did was cross-sectional rather than longitudinal, which would provide like better causal inference. Okay, so I'm gonna go to the next iteration. So we continue to collect Google Street View. So we used the Google Street View API, and this was in 2017, 2008, where the API was still free. In late 2000, like July 2018, Google converted it to a pay service. So we kind of did some of this work before it converted that. So we collected the data ourselves through their Google API. And we were able to get some NIH cloud credits to use Google's computer vision API to label each image for built environment characteristics. So Google has an API that will automatically label images. So it doesn't need to be Google Street View images. It could be any images. And this API is very general because you don't really have to fine tune it or anything. It just like, you know, tries to detect objects in the image. For each image, we were given 10 labels, and we use some of those labels to try to understand the associations between those characteristics and county health outcomes. So there were over 60 million images that we collected across the United States from street intersections. And some of the Google computer vision's API labels were highways. So this is an example of a highway, and the map is a distribution of the highways. Highways, rural areas, and grasslands. So as you can kind of see, because it is pulling from across the United States, not just in cities, these characteristics are very different in terms of the flavor from what we previously saw in the last analysis. So from the 60 million images, about 11% had a highway, 14% were labeled as rural area, and about 5% was labeled as grassland. And for the rural area indicator, we found that it's related to a variety of adverse outcomes. So we try to pick outcomes that are broad, just because we wanted to kind of see the limits and like the of which like these built environment characteristics can predict or relate to health. So we looked at the rural area indicator from Google Street View that was derived from Google Street View images, was related to increases in obesity, diabetes, physical distress, mental distress, physical inactivity, limited access to healthy food, and limited access to dental care. It was related to lower binge drinking. So that was the indicator. So the more rural the area, the worse chronic conditions and health behaviors and access to health care and food, dental care and food, but it also had lower binge drinking. So we compared the Google Street View indicator versus other indicators of virality that people can use. For instance, population density. It was like showing similar associations. So that's kind of like a validation for what the Google Street View derived indicator is picking up. There's also an indicator for it being a rural census tract, and that's just simply defined as if the census tract has less than 2,500 people living in a centroid. And then we also looked at the rural urban continuum codes for the small town and rural area versus metropolitan tracts, and those also showing somewhat similar associations. There's a little bit here difference for our physical inactivity. But otherwise quite similar. And it's just like the Google Sheet View tertiles were actually giving slightly stronger associations than population density and other indicators of rurality. I think the rural area is picking up other things too, like the actual built environment features rather than just the population count or density. Okay, so that was our work using the computer vision API. So this is the out-of-box computer vision API that anybody can use. But I would say that it was without the cloud credits, we probably wouldn't use API because it ended up costing, I think around 18,000 to run the API on the 60 million images. So it wasn't cheap, but we were lucky to get cloud credits to kind of do that exploratory work. So in the next series of work, we use in-house team of computer engineers to create 6 neighborhood indicators. So we have the original ones that we did in our pilot work. So green 30 crosswalk, not single family home. And also we added single lanes and visible wires. So these are just some pictures, and this is for pictures across the United States of some scenes. So the visible utility wires is just the what you see kind of overhead. That's quite common, but also very unexplored. So I get asked this pretty often why I chose visible utility wires. I think when we're looking at the images, we can kind of see that that's actually one of the features that quite stand out. And it can distinguish between areas and it's very understudied. It's more likely to be studied abroad where these utility wires can be electrocution risk and also a fire hazard when they fall. But in the US, they're just kind of an indicator of like, they're slightly unsightly and, not as aesthetically pleasing. So we use it as one of our indicators of potential physical disorder, but we also know that it's very understudied. So these are just some additional images. Okay, so the distribution of these characteristics. So greenness is quite prominent. Visible utility wires is also quite prominent, 61%. Single lane, so that just denotes like whether there's a single lane road or more than a single lane road, so 2 or more lanes. Not single family home we saw before, and crosswalks is the rarest indicator at around 6%, a little bit, so 6 to 7%. So during this time, we also experiment with different analytic approaches for predicting health. So one of the computer engineers said, tried a direct approach. So the direct approach is where we kind of know for instance, this is at the census tract level where we tried it at. So we know the census tract level obesity rates. So the model directly tries to predict obesity rates just based upon the images themselves. And then this kind of helps us identify potentially features that we wouldn't have gone after. So in the beginning, like if you were doing the indirect approach, you would kind of extract features that you're interested in, like crosswalks, green streets. But here you're giving the model the obesity rates, and then it tries to figure out how to group the images together to best predict obesity rates. And the R-squared, that percent variation that it achieved was around 0.49. So moderately good at trying to predict or like kind of predict the images that had high obesity, that came from high obesity tracks. But the downside is that it's kind of a black box. When it labels something as being a high obesity track, we don't necessarily know what features are being highlighted. We kind of would have to manually look through and identify what we think the model is pulling out and using as prediction, like using as part of its prediction for obesity rates. So I'm going to next go through some additional analyses with the new indicators that we have. So, and this is using 31 million images. And we looked at a variety of health outcomes, including premature mortality and mental and physical distress. So we see that crosswalks is generally good for our health, associated with lower obesity, lower very poor self-rated health, and lower premature mortality. Non-single family home is also beneficial. For us, that's kind of just an indicator of mixed land use. So you have building types that are, like for instance, schools or businesses or even apartments. You have like more variety in the building types, which can suggest closer access to resources. And generally across our work, we find that that's a beneficial for health, like that's generally associated with better health outcomes. Single lane roads, we see it being associated with like higher premature mortality. Single lane roads is an indicator of less urban development. If you see like an area with mostly single lane roads, that's potentially an indicator that there's, for instance, fewer freeways, expressways, lower development. And then visible utility wires are associated with adverse birth outcomes, so higher obesity, very poor self-rated health, and premature mortality. So we move next to census tract. So this is using the 500 Cities project, which has census tract level outcomes, and we look at these indicators. So for non-single family home, that's related to higher obesity. That's non-single family homes. That's a good indicator because it's that's related to lower obesity and lower physical inactivity. There was an unexpected finding where it's slightly related to more distress, but then that's like a small association, weak association, and it's only present for the second tertile. Visible utility wires is also related to physical inactivity and mental distress. And here there's also unexpected finding where it's related to less obesity. So across different analyses like census tract, we do see some unexpected findings, but visible wires is associated with more distress and physical activity. Non-single family home is associated with lower obesity, lower physical activity. So some of the main findings are there. It's just that sometimes like the second tertile for non-single family home, that was a little unexpected. So next we move on to individual level analyses. So with I'll go through two types of patient populations. The first patient population is from Intermountain Healthcare. So Intermountain Healthcare serves Utah and also some of the neighboring states. For this one, it's restricted to Utah. We analyzed 1.4 million Google Street View images from Utah and examined 2017 to 2019 health outcomes among close to 1 million adult patients in Intermountain. So this is the distribution of the built environment features. Crosswalks is the most rare, I would say. The other features are quite more prevalent. These are just the demographics and health outcomes and also the Google Street View derived indicators. Here we're working with 164 million images. So I didn't really kind of discuss how we collected this data. So at this point, Google had switched to a paid service. So we connected with Dido, which is one of the Google's third-party vendor, to purchase API calls. So it costs about $28,000 to purchase enough API calls to download 164 million images. And then we also had to figure out a way to download them all within 1 month because the API calls were good only for a month. So that's something else to keep in mind if you work with Dido or other provider that requires you to they charge on a monthly basis. Okay, so linking it with individual health outcomes, we see that green streets are generally associated with a lower chronic conditions. And we see that non-single family home is also uh, associated with lower chronic conditions, as we saw in the previous analyses. We see that visible utility wires is associated with adverse uh, associations. But one thing to note is for substance use, similar to kind of what we saw where the lower urban development was actually associated with lower binge drinking. We see it here too, where um, you kind of have areas like non-single family. You have more urban areas indicated by like non-single family home associated with a little bit higher um, substance use disorder. And for Utah is mainly like very sandy colored red rocks. And so when you have a lot of greenness, it kind of denotes potentially more urban development, more landscaping. And that's also like generally we are seeing like urban development being associated with more substance use. So we see it here as well. So for green streets and non-single family homes, that's generally associated with lower chronic conditions, so diabetes, uncontrolled diabetes, hypertension, and obesity, controlling for some predisposing characteristics. And conversely, we see visible utility wires associated with more diabetes, uncontrolled diabetes, hypertension, and obesity. So I'm going to quickly go through UCSF. So that's Utah, but people always ask, is that like, do you see associations outside of Utah? So we are looking at health outcomes from University of California, San Francisco for 2015-2017 health outcomes. So this is like a map of some of the features, and these below are some example images from the area. This is a table 1 characteristic. Here we're working with about 173,000 patients from UCSF. I would say Utah is going to be more diverse in Utah. So that's why it's also important for us to kind of see whether our Google Street View derived predictors are going to predict in a more diverse population. So oops, here. So we looked at green streets, visible utility wires, dilapidated building. Dilapidated building is a new indicator. So we're able to add on top of, because of visible utility wires as like, so both those latter two indicators are trying to capture a physical disorder, and they are generally associated with worse chronic conditions. Green streets is associated with lower chronic conditions, lower coronary heart disease, hypertension, and diabetes. So for the 173,000 patients or so, you see that green streets is generally associated with 12 to 30% lower in terms of coronary heart disease, hypertension, diabetes, and visible utility wires associated with 14 to 22% increase in coronary heart disease, hypertension, and then dilapidated building is also associated with, that's supposed to be higher chronic conditions. So I would say the advantages of Google Street View include its efficiency, relatively low cost, and you're collecting health neighborhood outcome data, but you're doing it in an unobtrusive way. Because in the previous types of data collection where you would actually visit neighborhoods, it would be like you would send your research staff into neighborhoods and potentially kind of like just, you'd kind of see residents and they could see you, and not all neighborhoods are perfectly safe. So Google Street View allows you to kind of do your data collection, comprehensively across the US, but do it in an efficient and relatively low cost manner. But I would say there are plenty of limitations, of course, with any data set. So there are time lags, and the time lags are worse for rural areas. The images themselves, if you're interested in people, Google will blur out people's faces, so it makes pedestrian detection more difficult that way. And small objects are hard to detect. And then you have to work with parked cars that are going to obstruct some views of the neighborhood features. And streets that are not accessible by Google cars won't show up in Google Street View images. So I would say that it's a good data source if you're interested in analyzing neighborhood context, and you have the flexibility of aggregating into any neighborhood shape. So zip code boundaries, census tract boundaries, your own predefined boundaries. So it has that flexibility because each image has a coordinate, geocoordinate that you can aggregate any way you would like. And we found through various different levels of analyses that it's predictive of health outcomes and a wide range of birth outcomes. I would say there's quite still a lot of work to be done. So I think we're interested in doing tighter control of confounding. So for instance, we are interested, the Utah Population Database allows us to know which individuals are related. So we want to look at, for instance, siblings and see whether differences in the neighborhood context lived by siblings predict the differences in health. So that would be give us tighter control of some of the background family characteristics and really try to isolate the neighborhood as like associations with neighborhood context rather than family background or other background. And then we also want to do some longitudinal studies, but that is difficult because your health outcomes data have to be longitudinal, and then your neighborhood context data have to be longitudinal as well. So that is quite expensive, and there's not many sources of that type of data. And then third is to look at individual level outcomes at a national level. So thus far, we looked at 2 locations, Utah and California. But we have already gotten approval to merge the Google Street View derived predictors with NHANES. NHANES has census tract, and the restricted version has zip code and census tract IDs. So we are going to merge our Google Street View derived predictors and try to look at health outcomes at the national level with NHANES. But I would say the caveat is that NHANES doesn't, interview people in all counties in all years. I think it does like 50 counties a year. So I think we have merged about 10 years worth of NHANES data to try to get at geographic representation. But that also means the time frame for the health outcomes could also vary quite a bit as well. That's all I have for like the current summary of slides, but I'm happy to take questions.
Awesome, thank you. So if anybody wants to